Hi, my name is Erica Blake, and I'm going to inform you about type 1 diabetes. There are three types of diabetes, but type 1 diabetes is an autoimmune system disease characterized by the body's inability to produce no insulin due to the destruction of beta cells in the pancreas. This disease has also been known as the juvenile diabetes because people who are usually diagnosed are children, young adults, and adults under the age of 30. Although there are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 is the most uncommon, so uncommon that only 5% of individuals with diabetes have this type of autoimmune disease. The body needs the insulin hormone in order to break down sugars, starches, and other foods to convert them into energy for everyday life. I have learned about diabetes in my health science classes for the past 4 years. First, I will discuss how the cause of type 1 diabetes is unknown and some ideas researchers think they have found about the cause. Second, I will discuss how they diagnose you with type 1 diabetes. Last, I will discuss how type 1 diabetes affects your body. The cause of type 1 diabetes is unknown, but researchers think they have some theories. Researchers are aware that genes play a role in the disease. But in order for genes to play a role, something must set off the immune system, causing it to turn against itself. If the virus has some of the same antigens as the ones in the beta cells, then the killer cells that fight off the infection may turn against the immune system and not allow the body to produce insulin in the beta cells. Although the disease can be inherited, something has to set the immune system off in order for the type 1 diabetes to be triggered. For type 1 diabetes to be diagnosed, your doctor will order for you to have a glycated hemoglobin test, an AIC test. This type of test studies your blood sugar level for 2 to 3 months to indicate average blood sugar level overall. To determine type 1 diabetes from type 2, your doctor will run blood tests to check for antibodies that are common in type 1. If you are diagnosed, the goal for the treatment is to keep blood sugar levels as close to normal as possible. Type 1 diabetes can affect your major organs. I have a diagram here showing all the organs it affects. It can dramatically increase your risk of various cardiovascular problems. It can cause kidney damage, nerve damage, eye damage, foot damage, and skin and mouth conditions. There are three types of diabetes, but type 1 is an autoimmune system disease characterized by the body's inability to produce no insulin due to the destruction of beta cells in the pancreas. Researchers may not be immediately finding the cure for this disease, but they are discovering ways for the 35 million people worldwide that are living with this disease to manage their diabetes and reduce their complications.